And thanks for joining us. Today, we're with Dr. Kimberly Terrell, who is the Director of Community Outreach at the Tulane Environmental Law Clinic. Dr. Kim will be speaking to us today about COVID-19 and air pollution in St. John the Baptist Parish. Kim?
Thanks, Scott. So this presentation is something that I put together at the request of the concerned citizens of St. John. And they are a group of residents of St. John the Baptist Parish that are concerned about issues related to air quality in their parish and in their community. And so one of the reasons to talk about St. John specifically is because that parish has the highest death rate from COVID-19 in the state of Louisiana. And that's by a wide margin. So the second highest death rate for Louisiana is in Orleans Parish. Compared to Orleans Parish, St. John the Baptist Parish has about a 50% higher death rate. And that death rate in St. John is also about 7 times higher than for all other parishes in Louisiana averaged out. And it's about 10 times higher than what we're seeing overall for the US. So if we look at the number of people across the US that have died of COVID-19 compared to the population of the US, that's a much lower proportion than what we see in St. John the Baptist Parish. So when I talk about death rates in this presentation, I'm talking about the number of people who have died per capita. So per 10,000 people in the population. And that's also to be consistent with a study that recently came out of Harvard University that I'll talk more about in just a moment. So the folks in St. John and the concerned citizens of St. John have long been concerned about their exposure to a particular type of pollutant called chloroprene. And chloroprene is known to cause lung disease. And people with lung disease are known to be at a higher risk of death from COVID-19. So the relationship between air pollution and COVID-19 death rates is really pretty intuitive. You know, we know that this novel coronavirus is something that affects our lungs and our ability to breathe. We know that air pollution also affects our lungs and our ability to breathe. And we know that there are many types of pollutants in St. John and elsewhere that are known to cause lung problems. One of those pollutants, which is a very common type of pollutant, is called fine particulate matter, or PM 2.5. And the 2.5 in that name comes from the size of these particles. So they're 2.5 microns in diameter or smaller. And so they're so small that you can't see them. They're about 1/30th the diameter of a human hair. And that's one of the reasons why they're so dangerous. Because they're so small, we breathe them in and they can get deep within our lungs. Our lungs act as a filter for the air we breathe in. And when really, really small pollutants are in that air, they can get deep into our lungs and even get into our bloodstream. And so particulate matter 2.5, or PM 2.5 as it's called, is a mix of different things. It's not a particular type of chemical. It's a mix of dust, chemicals, liquid droplets, any type of pollutant that is that small size. And these particles that are really tiny primarily come from burning. They come from combustion. And that can be from industrial plants, from cars, from fires. But there's been a lot of focus on this type of pollution in the last couple of weeks with respect to COVID-19, because a study from Harvard's T.H. Chan School of Public Health found a link between COVID-19 deaths and this type of air pollution. And so specifically, this was Francesca Domenici's group. And what they found was that a small increase in your long-term exposure to PM 2.5 leads to a large increase in COVID-19 death rate. And so specifically, they put numbers on it. And they said for every unit of PM 2.5 pollution increase, there's a corresponding increase in the COVID-19 death rate by 15%. And so when I talk about a unit of pollution, I'm talking about a microgram per cubic meter. The other big finding from this study is that there's no threshold for this, right? There's essentially no safe level of pollution in terms of COVID-19 death rate. And so the study found that, with each unit increase for PM 2.5 pollution, the COVID-19 death rate grows and grows and grows and grows. So if you increase PM 2.5 pollution by 1 unit, you get a 15% increase in death rate. If you increase it by 3 units, you would get a 45% increase in death rate. And so, the study looked at the entire country, at the entire United States. And it's important to keep in mind that Louisiana was part of that study. The communities of St. John and other parishes like St. James, where people are concerned about pollution exposure, were also part of that study. And so one of the reasons that the study is so powerful is because of the big scale that it looked at things across. So like I said, the study focused on the entire United States, and why that is powerful is because it allows you to really see the pattern between pollution and COVID-19 death rates. And the study also accounted for many other factors that influence COVID-19 death rates. So for example, they accounted for the population density of an area, the number of tests that had been done, the number of hospital beds available, poverty, race, age, income, education, all of that stuff was accounted for. And so once the study, once the researchers accounted for all those influences, they still found a pattern between pollution, specifically PM 2.5 pollution, and COVID-19 death rates. And so when we look at really big populations like the entire United States, there's always going to be some noise, right? There's always going to be some factors that affect COVID-19 deaths that we haven't thought of. How often you go and spend time with other people, whether or not you practice social distancing, things that there's just no way that we can account for. And so things like that are essentially noise. And if we look at a big enough population, the pattern between air pollution and COVID-19 death rates can essentially rise above that noise. The flip side of that is that if we look at just a very small community, we probably won't see that pattern because the noise drowns it out, right? But what we know is that when we demonstrate this type of relationship between air pollution and COVID-19 death rates, that applies across the nation. That applies to states like Louisiana and communities like St. John. And so one kind of interesting aspect of this study was the pollution data itself. So the study used a combination of, or a data set that combines air monitors, satellite data, and then modeling to fill in the gaps. And so the data set came from Randall Martin's group up at Dalhousie University in Nova Scotia. And so the authors of this Harvard study looked at 17 years of pollution data across the United States. And they present some really compelling maps, but what we wanted to do for the concerned citizens of St. John was to zoom in on Louisiana and see what pollution looks like in our state specifically, and in St. John Parish specifically. So, there's really kind of two big messages from looking at this pollution data in Louisiana. The first is that the state as a whole has above average levels of pollution compared to the United States. So across most of Louisiana, we've we've experienced higher than average pollution levels for PM 2.5 pollution. And so the map that I have here illustrates that. Basically, anything that is red or any shade of red is above average PM 2.5 pollution levels. And I also want to note that the World Health Organization recommends a limit of 10 units of PM 2.5 pollution. Above that limit, the World Health Organization says, that's when you start to see health effects. And even below that limit, you can see health problems. But so the second point that this map really illustrates is that there are dozens, if not hundreds of communities across Louisiana that live in hotspots of pollution, where the levels of PM 2.5 are even higher than the average in the United States and the average in Louisiana. And so those hotspots are primarily concentrated in the southeast industrial corridor between Baton Rouge and New Orleans, but also the southwestern part of the state, for example, near Mossville and Lake Charles, and then kind of everywhere in between Lake Charles and New Orleans along that industrial corridor. So the concerned citizens of St. John were interested in their parish specifically. And when we zoom in on that, we can see the point that I just made about these hotspots of pollution, right? So in terms of long-term PM 2.5 pollution, St. John as a parish has higher than average levels of pollution. But even within the parish, you see these hotspots of pollution that are at Laplace and Reserve, where people are exposed to even greater concentrations and concentrations above the World Health Organization recommended limit. So if we think back to the Harvard study and kind of what all this means in terms of COVID-19 mortality, we can really appreciate kind of the geographic pattern of COVID-19 death rates relative to the geographic pattern of PM 2.5 pollution. And so the data on this slide now are COVID-19 death rates by parish overlaid with the pollution data for our state. And something that really stands out is that we have a big cluster of high death rates in the southeastern part of Louisiana, where we also have hotspots of pollution. And, St. John, again, you can really see how dramatically high the death rate for COVID-19 is in St. John Parish. And in fact, most of the parishes with the highest death rates in Louisiana are in the industrial corridor, the southeast industrial corridor, or immediately adjacent to it. And again, St. John is seeing a death rate that's really unprecedented in Louisiana. So in addition to pollution, there are certainly many other factors that influence a person's risk of dying from COVID-19. And I don't want to diminish that. So we've heard a lot about pre-existing conditions, particularly in Louisiana. And we know that, for example, diabetes and obesity are risk factors that can increase a person's likelihood of dying from COVID-19, or at least they appear to. We also know that hypertension is a big issue. Unfortunately, we don't have good hypertension data because most people, or many people who have hypertension, which is high blood pressure, don't know that they have it. But we do have good data for diabetes and obesity. And so when we look at the geographic pattern of those conditions in Louisiana, we see a pretty different picture. So for example, St. John the Baptist as a parish has a relatively low rate of diabetes. Certainly there can be hotspots within the parish, but when we compare average diabetes rates and average COVID-19 death rates on a parish by parish basis, You know, diabetes doesn't fully explain what we're seeing in terms of the clustering of COVID-19 death rates, high death rates in Southeast Louisiana. And so similarly with obesity, many parishes in Louisiana have an obesity problem, and St. John is one of them. But there are parishes that have similar or higher rates of obesity with much, much lower COVID-19 death rates than St. John the Baptist. And in fact, the top 3 parishes for obesity rates have no COVID-19 deaths as of April 18th in Louisiana. And so all of this kind of collectively gets back to the issue of air pollution and the need to better understand what kind of pollutants people are exposed to so that we can, you know, take steps to reduce their exposure and reduce the corresponding health risks. And that's a big challenge in Louisiana and elsewhere, frankly. So for example, when we think about this particular type of pollutant, PM 2.5, that the Harvard study focused on, there are only about 20 sites in the state of Louisiana that have PM 2.5 monitors. And, you know, this is an issue because parishes like St. John and St. James don't have a single PM 2.5 state air monitor. So they're essentially black holes of information. We do have satellite data, which is part of the data set that I had just showed on this presentation. But even satellite data, there's a limit to the resolution of that information. So if you noticed, the maps are kind of pixelated, and they present everything on about a 1 kilometer or 2/3 of a mile grid. And so we know, you know, from the clients that we work with in St. James, for example, we know that there's neighborhood level differences in pollution. There are folks who live literally next to the property line of an industrial facility, and there are folks who live, you know, half a mile away who are breathing very different mixes of pollutants or have very different air quality in their neighborhood. So the more monitors that we can get, the better the information is and the more reliable it is. And so a lot of groups out there, including Healthy Gulf and Louisiana Environmental Action Network and Louisiana Bucket Brigade and others, are calling for community-based air quality monitoring, which I believe is incredibly important, because all of this tells us that, you know, knowledge is power. And people need to know what they're breathing and what they're exposed to. And so I want to wrap up kind of with a look at how air pollution has changed over time in Louisiana. So again, this type of fine particulate matter, or PM 2.5, is something that comes from many different sources. And Louisiana and the US in general have had good success in reducing the amount of PM 2.5 pollution over the last couple decades. And so these are a series of maps that use the same scale that I've been using this whole time. So for example, when we look at air quality in the year 2000 in Louisiana, the entire state essentially looks red. And that's because for the most part, PM levels were at 11 or greater at that time. And again, the recommended limit by the World Health Organization is 10. So you can see from the year 2000 to 2015, we made massive strides in reducing air pollution in our state. And this is true of the US in general. But then what's happened that's very concerning within the last couple of years is that Louisiana is reversing that trend, and we're losing ground. And in fact, you know, if anything, the disparity in air quality is becoming clearer. So if we look at 2018, at the most recent data set for this type of pollution, we can see that essentially the bottom half of Louisiana is becoming more polluted again. and that, the northwest corner of Louisiana continues to maintain the improvements in air quality that it saw over the last couple decades. But in parishes like St. John, which is illustrated in yellow here, and other parishes in southeast and southwest Louisiana, we're really seeing the problems coming back with air quality. And this is it's important to keep in mind that this is one aspect of air quality, right? This is one type of pollutant. It's a common type of pollutant, but these maps don't reflect the dozens of other types of hazardous pollutants that are being emitted, particularly in the southeast and southwestern parts of our state. And so, we know that industrialized communities in St. John, St. James, and elsewhere are overburdened by industrial pollution and the resulting health risks that brings, including COVID-19 mortality. And that link, again, has been demonstrated, or evidence for that link has been demonstrated by that study from Harvard University, which includes Louisiana. And so when we, that study relied on data up to 2016. When we look at more recent pollution data from 2017 and 2018, we see that Louisiana is slipping, and that communities in the southern part of our state, like the folks in St. John, are being exposed to a higher level of air pollution than in other parts of the state. So that's everything I have for today. If you have questions or want more information, feel free to reach out. My email is kterrell1@tulane.edu. That's KTERRELL1 @tulane.edu. Thanks.